The EPAs for general surgery in South Africa was selected to be broad and inclusive rather than a specific or narrow list of activities, and this was to aid national agreement, also to overcome some of the issues reported in other countries with the use of EPAs, specifically lack of opportunity for feedback and learning for procedures or activities that were not on the defined narrow list. There's certainly opportunity for refinement of these EPAs over time, but this was thought to be a good strategy for national implementation initially. These EPAs were developed with broad input, literature provided guidance, but also South African trainees and supervisors weighed in, and there was input not just from one university, but multiple universities in South Africa. The 5 activities or EPAs that were selected include managing general surgery outpatients, general surgery inpatients or an acute intake, performing open, laparoscopic and endoscopic general surgery procedures. The first EPA, managing outpatients, includes assessing, working up and managing one or multiple outpatients in various settings, including regular surgical outpatients, as well as pre-op or pre-clock admissions, and then MDT meetings. These include all general surgical conditions, and of course subspecialist clinics are included as trainees do spend time there. However, the expectation for managing of complex conditions is at a generalist, non-subspecialist level. Managing inpatients or an acute intake or a call includes management of ward patients as well as new admissions. It includes assessment, workup, and management of pre-op and post-op patients, as well as non-operative patients that are admitted for management or investigation, and includes patients in the ward but also in the ICU or high care. These EPA observations are based on the trainee's presentation of one or of multiple cases that are seen for the usually morning consultant ward round, and they may include current or new admissions. And again, trainees expected to manage complex conditions, especially in subspecialist rotations, at a generalist level. Performing open procedures includes any open procedure or a significant part of a larger, more complex procedure that a general surgeon can reasonably perform. There are specific key procedures that are defined that are most frequently performed by South African surgeons in practice, but also frequently observed during training, which includes hernia repair, laparotomy, mastectomy, as well as an intestinal anastomosis or stoma. But essentially any open procedure that a trainee can do, including the list that's shown there, can all inform whether the trainee is able to perform open surgical procedures and has that skill set. And of course, there's opportunities for the trainee to learn and get feedback on execution of these cases. Laparoscopic procedures, again, any laparoscopic procedure that a general surgeon can reasonably perform. The key procedures here being appendicectomy and cholecystectomy that are frequently performed and supervised in training. And again, any other laparoscopic procedure can also allow the trainee to get feedback on their execution of that task, as well as inform their ability to execute laparoscopic procedures in general. Finally, endoscopic procedures includes upper and lower flexible endoscopy. Also to note that for all the procedural EPAs, there's a difficulty rating being the same difficulty or more difficult than usual, which provides some context to the supervisor's rating of the trainee's ability to execute the case. Finally, it's important to note that the trainee logbook is still helpful, and this gives some context to the trainee's exposure during their training, understanding of especially more complex cases, and that the initial college requirement for submission of observations will emphasize participation only. And this is important for initial uptake and also to realize the educational value and emphasize that from the outset. Assessment of observations and portfolios of observations for competence purposes to determine if trainees are competent will only happen down the line.